So thank you very much to Kurtisha for having me and Hina as well. And Hina initially wanted me to talk about the menopause for an hour. And I meant, menopause for an hour on Monday? Like, no way. I thought it would be probably more beneficial to have a bit more comprehensive talk. So we will talk about the menopause and then do some extra things as well. And so we're going to have 4 little topics today. We'll have the menopause and breast cancer, which I thought would be useful for that's the commonest cancer in women. And then also we'll have the health screening tests and the cervical smear. And we have Mrs. Dada to assist us with that. She's an experienced health visitor and a registered nurse, and this is obviously her bread and butter. So she'll probably be better than me to do that because they do more of it than we do as GPs. And then what I thought would be helpful, because obviously it's quite a lot of topics to go through, is after each section, just stop for a few questions, and then at the end, then we can answer a question. I think it's very important when women come together like this and you have a health talk, that you get the questions that you really think are in your mind, just get them out, because obviously I appreciate that it's not that easy to get to see your GPs these days, and we're always in a hurry. But this is an opportunity, an informal way you can sort of talk about things that are bothering you, and time permitting, we'll go through as many as we can. So as Hina alluded to, women these days are doing all sorts of things. We're very busy on the home front. We're caring for children, husbands. What will they do without us? And we're also caring for elderly relatives. More, it's becoming an issue now where people are coming and having to care for elderly relatives, and it's quite hard to juggle it all. And again, women are taking their role not just in the home but also on the world stage. So we have obviously Prime Minister is female, Queen. We have lots of world leaders and people in professional roles as well. So I think it's very important what you're doing here, trying to get your health addressed and sort of be aware, because information is key. So without further ado, we're just going to the menopause. Now the menopause is a bit of a misnomer, because when we say menopause, it's not like your TV remote control where you just press pause and it stops. It doesn't work that way at all with menopause. But the menopause is more, actually it's a diagnosis we make in retrospect. So what does that mean? So when a woman is coming up to the age of 51, so you can start anything from 45 onwards, you find that your periods, if they were regular before, maybe every 28, 30 days or what have you, you find they're not as regular. So they're either coming in, taking a longer time to come up, and then coming and lasting longer, or the opposites. You're like, oh, period, where's my period this month? And obviously you're not pregnant because you've checked, hopefully. and so you don't have a period, and you just sort of wonder what's happening. So what happens is, for the first 2 years or so, around that sort of age, so average age in the UK, this data is based on Caucasian women. So obviously ethnic minority women might be slightly different. But we usually say about 50 to 51, and you would find that you're getting this waxing and this waning and waxing and waning, and where is it not? But what happens is, if you now don't have a period for 12 months, then you can look back and say, I'm now in the menopause. And it's important to remember that 12-month mark, because if you then get a bleed after that, that's called a postmenopausal bleed after 6 months after your menopause, and that can be an indication of some serious illness. So you need to be aware of when you've had the menopause, and then if you get any sort of bleed around that time, it's always best to see us. And we always fit such women in very quickly, because we want to make sure there's nothing untoward going on. So when I used to work in Hampstead Gardens, I had a lot of Caucasian patients, and they hated the menopause. And they absolutely dread it. And some people just get on with it. Some people don't, but nobody ever celebrates them. Oh, I'm in the menopause. You don't hear that at all. So I just wondered, how do you regard it? I mean, what's your experience? Is it a big deal? Not an issue. Okay. So I don't know if this is going to work. I had a little clip, but are we connected to the internet?
No.
No. Okay. So basically, you can just look this up later. This is healthtalk.org, and it was just a really like 1 minute clip of different women just saying how they went through the menopause, and it's quite interesting. But I will touch on those things there. But it's just an interesting thing. I thought if we had internet, I'll show you. Now, believe it or not, someone's making money off the menopause. So this is a card that you can actually send to your friends, and that's the envelope to post it in. And actually, it's a bit of humor, which I think is always good, to have a bit of humor, not to take life too seriously. But actually, it summarizes the symptoms of menopause really well, because the first two up there, one is itchy, the other one is bitchy, and then there is sweaty, bloaty, sleepy, forgetful, and psycho. And just remember psycho, because we'll come back to her later.
Psycho is the worst one.
It is the worst one, yes, definitely. So why does the menopause happen? So obviously nothing can go on forever. So as women, we get into puberty, we start to be reproductively active, we're ready to have our families and what have you. And the good thing is that it all stops at some point, so you've got to have a break from that. So what happens is that the estrogen levels are now being reduced because you don't need it anymore, you don't need to be in the reproductive phase anymore, and that's why you start to get other symptoms of menopause. So basically it's a phase of life, so you get there, you have your puberty, you're reproductive, and about the age 45 upwards, things that sort of peter out a little bit, and then you get to the pause, as we talked about earlier. So basically the hormone that is reduced then is the estrogen hormone, okay? Now, unfortunately, some women before the age of 40 may have this premature menopause, which could either be due to just, idiopathic, we don't really know what causes it, or if, they've had to have surgery or some sort of cancer or some treatment with chemotherapy, then it might be induced in them. So if they have, so they might have premature, so that's called the premature menopause, because I said menopause is something that would happen but premature. So obviously the symptoms now you're going to get are due to the fact that you don't have enough estrogen. So there's hot flushes, the night sweats, as we saw in the card. Now, because estrogen not only supplies our reproductive tract, it also supplies our urogenic structure, so basically the bladder and things that help us to have to pass urine, basically. So reduced estrogen then means you get dryness down below in the vaginal area, you get women getting more frequent urinary tract infections, so you find that, oh, I was fine before and now I've gone to menopause, I seem to be always having a urinary tract infection, so that happens. Then the other thing obviously is that the dryness and then the low libido, they may affect intercourse, because obviously it becomes very painful. You're not as lubricated as you were, and you might find that the PCB, that just means postcoital bleeding. So basically you're having intercourse and you get some bleeding afterwards. That's because that area is a bit dry. So these are things that you may notice in the menopause. And then the other thing is to bear in mind is that obviously the bones get thinner as well. And that could also be hampered by if you already had osteoporosis or any sort of bone conditions as well. And then the psychosocial, which as you said is the most important, is the mood swings and the teariness and just feeling low and just feeling very unworthy. And it can be difficult for some women who go through that and being forgetful as well. So I remember one of our colleagues would be having a meeting and she'll say, oh, I'm getting the senior moments here. And we all knew what that meant. She couldn't remember what she was going to say. And I think I'm beginning to get a few of that as well. So, and then also the increased risk of heart attack. I know you wanted me to touch on that as well. That's because when you have a lot of estrogen, it helps us to keep the good cholesterol high and the bad cholesterol low. So what happens, obviously, when you don't have the estrogen, then you might get that reversal. Obviously, these are things that also depend on other things like what you eating and the cardiovascular risk which you might have by benefits of your genes or family history and what have you. So there's the increased risk of, it doesn't mean because you're going through menopause you're going to have a heart attack. So please, it's just saying that you have an increase because that protection is removed, okay? Then the generalized pruritus just means itching a lot. So just to reiterate a bit, because I think this is where menopause gets its bad name, is the mood. So you just imagine this lady in about her 50s. So she's probably about, doing well in her career. By the time you're 50, sort of more or less you're settled, aren't you? Sort of like, you've gone your career path and probably you're managing departments or you might be, if you've been a homemaker, you probably have older children, teenagers who are very unuseful and I don't really care about anybody else, sort of in their own world. So you can imagine this woman going through all these sort of symptoms we mentioned, sweaty, itchy, bitchy, sleepy, whatever, dopey, forgetful and psycho, and then dealing with perhaps a husband going through the midlife crisis, and then you now have the children who can't be bothered, and then you now have work. So you can imagine that woman is not only a nightmare for herself, but she's also a nightmare to be around, don't you think? She's a nightmare to work for, she's the boss, she's a nightmare to be a friend, she's probably always weeping and everything, so it can be difficult. And again, if you're getting lots of night sweats and hot flushes and you can't sleep properly, you can just imagine the exhaustion. And nowadays life is so unforgiving, isn't it? We've all got to be able to get up and go and do this and do that, multitask, and it is getting a bit much on women. And so she finds that she can't cope. So ADL means activities of daily living, so you just find you're just struggling. I mean, I have a lady who is 45, 46 now, I think, and she came to me, said to me, she said all her symptoms and we realized it was the premature menopause. And then after lots of consultations, because it's not something you can just decide in 10 minutes, she gave her things to go and read and check. And she said that she was just going to go on the HRT. And I said, you know what, you're less than 50, you should be on the HRT because you're being shortchanged. Everyone is getting up to 50 and then I said to her, go on it. And she came back, because I bring them back for reviews. And she said to me, Do you know, even my husband says thank you because, she was so much, and she could cope with her family. She had 2 young children. She could cope, and that's what it does. It really helps. And then obviously, if the lady has gone through menopause and was sort of hoping, because people are sort of leaving off getting married or getting settled down much later, either due to choice or career or not even finding the right person, as someone said. So if she now finds that, oh my God, I've gone to the menopause, it is devastating. I have someone like that as well, and I felt really sorry for her because something she was hoping that she would get round to and do. So it becomes a lost opportunity. And then again, the people might feel unattractive, shriveled up. Someone said everything going south, no longer feminine or attractive. So this is the menopause for you. So how do we treat this? So you'll be pleased to hear there's a pill for every ill. So like the menopause, that video I was going to show to you, which we didn't get to see. One lady said, I feel like a bit of a fraud, really, because menopause, what menopause? Some people just, nothing. It's like, oh, okay. Did it happen? Okay, you must have. Well, so if it's not a problem for you, then don't do anything. You don't have to take a medication. It's like I said, it's part of life. So you can just grin and bear it. These too shall pass, as we say in our circles. And then if you have symptoms that a bit difficult, like that cycle lady. So I remember when I was many years ago, I had this lady and she came to me. She was trying to convince me to give her menopause, and this is when we're still a little bit reticent about giving it because we had this WHI study, which is like a study that sort of did some research that scared everyone about menopause and HRT rather. And she said to me, please, please, please. And the only thing that made me give it to her, said, I feel like killing my husband. And I said, never mind you, I want to save your husband. Because I don't want to be on the news and they say, oh, the patient has killed her husband because she was psychic or whatever. So we had a little laugh about it, and I said to her, don't worry, we will save your husband, we'll treat you. So she got medication. So as I said earlier, that certainly if it's a premature menopause, then they should really be on it. But obviously, today I was just saying to Dupe that I had a request for 2 patients. One is 64 and she wanted more of her HRT patches, and the other one is 72 and she wanted more of her HRT patches. And I said no, because I hadn't seen them before and nobody had checked on them. So they sort of got just left on it, which is safe, but it's never really too safe. You should really be checking on them, bringing them back in, doing little checks. So I said to them, just come and see me, let's have a little chat about this. So basically the point I'm trying to make is that women do go on this for a long time if they need to, and that's the point. If you need to, if you're low risk, you've done anything else wrong, because the reason why is because 2% of breast cancer, which is our next topic, is caused by prolonged HRT. So you can imagine someone who is 64, she went through menopause ages ago, she should really be thinking about whether she needs it or not, and she may need it, because when I used to work in the menopause clinic at the hospital, we did have patients in that age group who had difficult menopause, suffered a lot, and so we had to treat them. But I think it's a case-by-case basis, but most women sail through it. We have 8,000 patients, don't make it, and we don't see that many with menopause, so it's not a very common thing, maybe because people don't talk about it, we don't know, but if you do suffer, there's help at hand. If you are less than 50, definitely I would say please go on it, because otherwise you're going to end up with osteoporosis, if you get shortchanged with your estrogen. And if you have to go on HRT, the safest way is a patch. So it's a patch, waterproof patch. You just put it on there, change it twice a week. If you don't like the idea of a patch, maybe you have an allergy to plaster or something, or you have hairy skin, it doesn't stick on, you can go on tablets. If the problem is mostly intercourse, so it's down below, is a dryness, and that's your main problem, you're not really complaining about the hot flushes or anything, then in that case, just use localized treatment, just the creams, other lubricants and things. So let's see what we have on next. So yes, some people are very anti-HRT meds, and that's fine. I get that. And so for them, it's like this lady, keep cool. So basically, I have another lady. She's how old is she? She said to me, and I sleep with the fan on, and I look out of the window, because when we had that cold spell, I thought, and she said, and my husband, and before you ask me, I'm still married and he sleeps with me in the same room with the cold. I'm like, oh. And she said he's learned to deal with it. So basically, if you don't want to go on medication, just do something to keep yourself cool, relax. If the mood is the problem, you can go for some counseling. As I said before, if intercourse is the problem, vaginal lubricants can help. St. John's Wort is something you can buy over the counter. It does help with depression and low mood as well. But be careful if you take other medication, because it has a whole list of medication that it doesn't go well with. So just be careful about that. And there are things like ginseng, black cohosh, red clover. all these sort of alternative therapies, we as doctors don't know that much about. So that's be my disclaimer. That, but I do know that the health shops say that it works. So if anyone has tried it and it works, come and convince me afterwards. And then there's something called yam. Do you know what yam is?
Yeah.
So yam has phytoestrogens, and many people that eat yam, would keep looking supple. So there might be some truth in that. So I think at this point, my summary is that, like death and taxes, the menopause is coming as long as you live long enough. And I think my suggestion is that, don't be scared about it if you haven't been through it. Just, it's going to happen. Just get on with it, as Theresa May will say. And it is a time, to sort of put back that period of life where you were having children and getting pregnant, having periods and what have you. And just see it as a new phase of life when you can do mountain climbing and whatever the things the WI women are always doing. And then further, if you want to learn more about it, obviously the NHS has a nice leaflet on menopause symptoms, which you can always address online. And I'm happy to now take questions on the talk, if any. Okay.
So how long do the symptoms normally last? Is it, is like you said, 50, 51 is the age. Is there kind of an average of, does it last a few months to a few years? Or
That's a good question. Excellent. I forgot to mention that. So usually the period around the menopause is the perimenopausal period or climacteric in medical terms is 1 to 2 years. But every woman is different. Some people might just be breeze, and then some might unfortunately be suffering even in their 60s and 70s. I had another lady actually. She's an Asian lady actually. She's 64, 5. She came last year. She really struggled. I think it was the night sweat that was her issue. And then she said to me, so she was very reluctant to start. I think she had done alternative and she wasn't. So I said, okay, do you know what? We've had a chance. Let's look, just try it for a few months. Let's see. You're quite low risk, blah, blah, blah. So we did that. And then the next thing she comes to see me, oh, Dr. Gomo, I'm going off to, where was she going again? Once exotic place. And she came back. And she came back again. She said, oh, Dr. Gomo, I'm going. I said, you keep traveling. She's having the time of her life. She has so much energy. She was looking very pretty, very young. I said, oh my word. I said, you just take me one of your trips. Oh, Dr. Gomo, I'm busy. I'm going somewhere. So the point was that she was doing well. And then she came to see me a couple of weeks ago. She said to me, oh, now I want to stop. Now I'm fine. So she was only for 10 months. So she's going to stop now. So I think the thing is, if you need it, it's going to make your life better. The patient who was 70-something, another patient of mine who had it and who begged me, she said to me, look, I don't care. I just want to enjoy the life that I have. Without it, life is miserable. I want a quality of life. I don't care, but I know the risks. And as long as the patient is like that, Compass Mentors understands the risk, wants to have a try, and there's nothing overtly wrong, but she couldn't have it. You're just being like ageist, so to speak, and saying you're old. No, we're now encouraged to just prescribe and let the patients, see how they get on. But obviously review them at least once a year. And that's why those other ladies are getting called in, because no one's seen them. All right, any other questions?
How do you actually do your levels? Is it through a blood test? Or?
That's a good question. So the nice guidance is after 45, we don't do levels.
Okay.
So we're just going to go by how you're feeling, your symptoms. But if you are younger and you're getting what we think are menopausal symptoms and we're not sure, then we do levels to see whether your hormone levels or your FSH in particular is one we're looking at has dropped. But if you're of the age, as I said, when we expect it to happen, then we don't need to go testing for something that we know is going to happen to everyone. So we don't do that. The caveat for that is in patients who are on hormonal contraception. So for example, people who are on Mirena or are still on the contraceptive pill, because they are taking hormones, they might be masking things a little bit. I mean, they won't be absolutely sure. Then we might do blood tests for them. This is a one-off, but not really. We don't really use blood tests after the age of 45, and that is nice guidance. Any other questions?
Does going on HRT increase the risk of breast cancer?
Yes, it does. So I was saying earlier that a 2% risk of 2% of breast cancer cases will be due to HRT, which is why you choose your patient carefully. Obviously, someone comes and says to me, there's breast cancer in my family. I'll be like, sorry, go and try some clover or ginger or something. You see what I mean? So, but if someone comes and says there's no such history in my family, and it's absolutely fine. You do the breast examination, which we'll talk about in our next talk, and you can try it for. You're not going to get breast cancer from what we know. Obviously, research keeps coming out. If you try HRT for a year or two, it's normally the people who've been on it for years and years that have. So your risk comes with the duration of use. Does that make sense?
It's just that I was on HRT for about 20 years.
For 20 years. Oh. Oh,
I had forced menopause basically.
I see. Okay, so you had to go on earlier. Yes, yes. Yeah. Well, you look good. You still on it.
She's like your traveling lady.
Yeah, she's always going around. That's nice. So any more questions?
If somebody had hysterectomy done,
Yes.
can they still go to
That's a very good question.
Yeah.
So, because when we do HRT, the hormone replacement therapy is 2 hormones. So you give both the estrogen and progesterone. So, like I said, the symptoms you get were due to the estrogen. But if the woman has her womb in place, then she needs both estrogen and progesterone to counterbalance the other one. But if she has no womb, then she just goes for the estrogen only.
And is that still a patch if it is just estrogen? Or
Yes.
is
So
it,
yes. So then you get the overall patch. Yeah.
And I have
And you
another
try and use
question.
the lowest dose. That's
Okay.
yeah. Do the lowest dose that can minimize. So you try the lowest dose first. Everything's all done to be safe. And if the low dose, sorts you out, then fine. There's no point going to a big dose if a small dose would do.
And night sweats, is it always just at night or that they do happen anytime?
Well, that's a good question. I think it's mostly at night because I haven't heard anyone saying about sweating the day. But what they tend to say it happens anytime is the hot flush.
Yes.
So you just sit in like a whoosh. I'm told. Yeah, so that can occur anytime. But I think nights are more at night. Yeah. You have a question?
Yeah, I was going to ask, I know some friends who talk about it and say actually anxiety is a big thing as well during the menopause. Is that something you've come across or not?
Not really. I mean, what are they anxious about? It'd be interesting to know because are they just anxious that they're getting all this? Because sometimes, that change in your body and not being aware of what's going on. And that's why I think what you're doing is brilliant. Being aware of, what's to come, basically, if it hasn't come. And, if it has come, that's what I was going through at the time. It's important because if you don't know, then you're still like, anxious. You're not sure what's going to happen or how long it's going to last for, like you asked. So these are things that are important. Yeah. In fact, I was invited to a marriage seminar. That's a little story. I like telling stories. And then when I got there, this is a Pentecostal preacher, and he's meant to be talking about marriage seminar, and he talks about the menopause. He did a brilliant talk though, and I wondered why. He said because they need to understand their wives.
Yeah.
Because don't forget, at that time the marriage is like 20 years, whatever. Everyone's getting a little bit stale, and you don't see this woman changing, beachy, this, sweating. Should I be swapping her for someone else? So he did that to sort of teach them what their wives were going through, and so you can get support. Because it's a time, if like I said earlier, these two shall pass. If it's going to go, and the husband thinks, okay, we just need to greet and bear it, she will come back to me, then that's probably easier.
Yeah.
But obviously, if he thinks, oh my God, what's happened to her? Then it's a person. I think it was a good move on his part to do that, to teach the men. So go back and tell your husband.
I think we should have invited the
You
husbands
should have
to this
invited-
one.
Exactly. Yeah, definitely. So
How would you deal with maybe let's say after 8 to 10 years having gone through your menopause and then you still get all the symptoms?
All the symptoms.
Well, not all, part
Yeah.
of the symptoms.
Then you can get some treatment, maybe for 3 months, 6 months.
Like what?
So any of the HRT,
Oh, okay.
yeah. So in the patches, depends on what symptoms a person has. It's an individualized treatment. So you obviously have a chat and you say which one is your problem. If you're getting what we call the vasomotor, so the flushes, the night sweats, then you need estrogen. Okay, so that could just be the patch. Is the safest way to take it. But the patch is going in through the skin, so transdermally, as opposed to taking it by mouth and going through your whole system. Okay, so but if the problem, as I said, is just intercourse is a problem, you're feeling dry or low libido, then you could try the estrogen creams. You see what I mean? So basically, if you come and see us, have a chat with your GP, and it might be something that they'll come, they will speak to you, give you a leaflet to go and read. And then you'll say what is your issue, what do you really want sorted out, and then you just try it for 3-6 months even, As I say to my patient, I'm giving you the prescription. Once I give it to you, it's yours. It's in your power. If you don't want to take it, because it's a tablet. If you don't put it in your mouth, do you see what I mean? But at least go and have that conversation. Don't suffer in silence. I don't think it's worth it. With 21st century living, you really need your energy. Okay, so I think should we go on to the
One friend, she's under 45 and
Right.
her periods has stopped.
Okay, completely.
But she,
For a
since
whole
when
12
we
months?
talk,
Okay.
and but she feels very normal. I mean, there are not any mood swings or nothing,
Nothing.
and even physically she feels normal. So what to do for that?
So like I said, so she falls into the premature menopause. So she's not really going to, they don't tend to get any bad symptoms per se. Don't forget they've still had estrogen all this while. So she will be fine for a while, but she might start to feel it later. So she might be a good, I mean, I'll probably say, I don't know her, I don't know her history,
Yes.
well, probably HRT is not a bad idea for her. Like I said, if we're based on the UK, where the average age is 51, 50, so, you know, she's obviously going to get 5 years not having estrogen, even for her bones alone, for bone protection, so that she's not at risk of osteoporosis should she fall when she's an older person. Obviously, if you have osteoporosis and you're an older person through the menopause, you address that. You don't always have to have HRT to treat that. Exercise and diet with calcium. So basically, calcium-rich foods will be good for you. And then there's another tablet called bisphosphonate, which we can use for osteoporosis. So you don't have to have HRT to treat osteoporosis per se, but it is helpful. Yeah. Should I go on to the next talk?
Yeah,
So we have
thank
enough time. So our next talk is the breast cancer. So basically, I just thought I'll just touch on that because obviously with women's health and all that. So if a woman says to you, I had breast cancer, you wouldn't be given any prizes for guessing it was breast cancer because that is the commonest one. There's a lady on the news, I think about last year or maybe the year before, and she was saying, I wish I had breast cancer, which is a kind of like the way the press sort of picked up on it. I don't know if you remember that story, because she had, I think it was pancreatic cancer, and that is a very bad prognosis. So that basically means 6 months to live. And she said, if I had breast cancer, I knew that I would probably get through this. I will survive. It's very well researched. There's a lot of treatment out there. And so she was bemoaning the fact that her particular illness hadn't had so many treatment options. So basically, it's good news. So this data is from Cancer Research UK. In 2015, nearly 55,000 new cases of breast cancer, and 12,000 died, which sounds a lot, but 78% survived, and that's what I want you to remember, okay? So that the survival rate is quite high. 23% of cases of breast cancer are preventable, so it's not always something you can't do anything about. We'll talk about that later. And it affects men too. So if you have any men in your life and you notice any lumps, don't say, oh, be quiet, you're fine, be a man, send them in, okay? Now, with breast cancer, when a woman comes in and she says to me, oh, I have a breast lump and it's painful, immediately just tell her, shh, painful, not breast cancer, normally. So it's normally a painless lump, okay? So painless lump, usually on one side, it'd be very, very bad luck to have breast cancer on both sides of your breast. It's normally one-sided lump. And then if you have skin changes, and that is really advanced, that's probably stage 4, skin changes will be looking like the breast, instead of looking smooth, it's looking like the back of an orange. So that is not good. And then obviously, when I examine, or when my colleagues examine, we check for lumps as well on the same side, because obviously if it's going to spread, it starts from the same side. And people feeling tired and bone pains, because the breast cancer can spread to the bones, can also be a sign. And unexplained weight loss. So you're losing weight, and you haven't done anything really to lose weight. Those are sort of alarm bells that you should be thinking about. And then, as I told you, about 23% were preventable. So there's what we call non-modifiable, means things you cannot change. So as we get older, as women get older, anyone really, the human body, the risk of cancer increases. This is above for everybody. So obviously more than 50, and that's why we do the screening. I'll come back to that. So age more than 50 and family history. So if you have a family history of breast cancer, then obviously you are at greater risk than someone else in the society. But there are things that you could do. So these are called the modifiable risks. So if people are on the pill, we don't like women on the pill more than above age 35. We still give it up to age 50 if you have nothing wrong with you, but just realize that you're basically to the patients, even the young ones, you're putting yourself more at risk of breast cancer than somebody else, same age, same everything as you, but not using that pill. So just be aware of that. Smoking obviously is a no-no. Obesity, because you're giving lots of fat cells which can cause breast cancer. And prolonged exposure to estrogen. So we mentioned about the premature menopause. So anybody who starts their periods early and finishes late has had a very long spell of estrogen, especially if they have no children as well, because pregnancy obviously gives a bit of a break from estrogen. So they also have a risk of breast cancer higher than their peers, and not breastfeeding. So breastfeeding is protective. Having said that, unfortunately, one of my colleagues, she breastfed, she didn't use the pill, she wasn't particularly overweight, she didn't smoke, and she still got breast cancer. So this is just to show, and there's no family history. She's a GP. So so these things happen to people. So that's why I really like to talk to people about it, because I think, you know, if it's worth saving one person, then, you know, we should try. So we've talked about the symptoms. Obviously, the treatments. Now, if someone has a breast cancer, you find that it's not just you; it's the whole family that suffers. When I did the breast cancer TV series, my patient was actually another Asian lady as well. She just bravely put herself forward to come and tell her story. And what it was with her was that she's very aware. She used to read those magazines, so she knew to check herself. So she was just checking the shower as she did, and then she realized that she had a lump in her breast. And then the story she tells was that she went to get it checked out, and she was so shocked because she went on her own. She didn't even take her husband with her. And when they told her it was breast cancer, she was like, huh? But it was the size of a kidney, 1 centimeter. It's a kidney bean, is it? Yeah. So she used that word, kidney bean, and it was really small. But the thing that touched me in her story, she said, and that was when my son was starting school. She only had one child, and in September, she took him off to school for the first day, went to the hospital, only to be told she had breast cancer. And she said that he grew up in a sort of like cancery house, and everybody was just talking, whispering, and aunties and everybody coming around. And in the end, he just knew something was wrong, but he didn't know what it was. And he got quite upset, and it was affecting him at school and all that. So basically, the whole family does get involved. So that's why it's something that can be quite devastating. It's not just you, the patient, suffering. Always lots of hospital appointments with all that entails. But when you get in, with we will start with an ultrasound, which you probably all know what ultrasounds are, jelly scans, and then a mammogram as well, and a biopsy of the lump. So if we find the lump, we take a sample out to check it to see if it's a benign disease, which means not a cancer, and the opposite being malignant. And if it is a cancer, then there's a CT scan, so lots of tests to go through to see if it has spread. Because basically, if it's spread, then you have to be more aggressive in the treatments. And then obviously there's removal, chemotherapy, radiotherapy. And then what happens, another lady of mine who had breast cancer, so now she's gone through it also, she's lost her hair. Sorry. That's okay. Yeah, so there's always someone that forgets the thing. Yeah, so basically, so what happens is because the patients are doing so well and they're surviving, we're finding that they're now coming now saying, oh, this is wrong. I remember her husband said to me, she was in the temple and she looked darker than every other woman. I thought, oh my God, what am I supposed to do about that? And so he's coming in with all sorts of, I mean, this is someone that was, worried that he's not going to be alive, and now they're alive and she's well, her hair has grown back and it's nice and long. She's worried about things and the other. But that goes to show you that now people are surviving, they're picking on the finer things. My nails are darker, I'm itchy. And I'm like, don't you ask your specialist about this? She doesn't have time. I said, I don't have time either. But you're the GP. I'm like, all right. So, they come to us to have a chat because, we're the doctor. So, what I want to end this talk by saying, before I hand over to my colleague, is self-breast examination. I mean, I don't need to overstate it. I've given you a life story of somebody that, just by checking her breasts, was able to find out that she had a lump. If you pick it up early, she's still alive today. Her son is now in secondary school. She's okay. She's off all the treatments. So that's a nice story to remember. It's all because she checked. And what I advise women is you check at least once a month. Usually after your period is a good time to remember you're in the bath. Get used to what your breasts feel like normally. Always check with the flat of your hands. And then check, divide your breasts into 4 and sort of go round. And then if you have any discharge from the nipples, things like that, any lumps that weren't there before, then please come and see us. And we always take it very seriously. When you get older, to the age 50, and some places there's a pilot going on from age 47 for some areas, you get invited to a mammogram. Please go. I have a patient said, I'm not going, it's too painful. I think chemotherapy and surgery might probably be more painful than a mammography. So I would say if you get invited, because we are very fortunate we have the NHS here that gives us all these things for free. Let's take advantage and get checked out. And so I'll take questions now. Any questions on breast cancer?
What are the chances of, there's different stages of cancer, stage 1, stage 2. What are the chances of surviving? Of survival.
So stage 1 is like 99 to 100%. And stage 2, I don't remember the figures top of my head now, but I know stage 5 is like 20%. And obviously, we're talking about 5-year survival. But stage 1, stage 2 are quite good, it's quite high. So it's like, God forbid you had to choose a cancer. You know which one, but God forbid. So basically, the take-home message is that there are things you can do to prevent it, and the best thing is just to check. just check and see and make sure you're fine, and then pass on the message to your colleagues and friends and family.
Is the treatment of chemoradiation compulsory then?
That's a good question. So it depends on what you have and the type that you have. So most people, another lady who got diagnosed December, I know of her. So she's not having any chemo. She just had surgery and radiotherapy. So because what happens is that now the treatment is so well advanced that they can even tumor type, they can say whether it's estrogen receptor positive or not. And so they tailor the treatment almost individualized to the patients. So they can say, oh, your particular one, you don't need this, you need that. But most people will end up with some sort of surgery. Obviously, you have to take it out. And you might have to take the breast out as well, depending on how far it's spread. And obviously, there's reconstructive surgery. And actually, just today, one of the patients, I was doing the letters, and she has the BRCA2 gene. You probably heard about that. I think it's the same one one of the celebrities had. I won't say any names. And because of that gene, it makes her more at risk of breast cancer. So she's having her breast removed without any cancer to reduce the risk. So they sent her to have a psychological assessment to make sure that she understood what she was doing. And she's again in that sort of age group where she's top of her game professionally. She was very well understood the risks, understood what she was doing, but felt that she was giving herself a chance because she already had the genes stacked up against her. So if you don't have the genes against you, they don't give yourself the other modifiable risk factors. You try and avoid those.
If the breast removed, what are the chances of somebody coming back in the same place?
That's a very good question. It can come back. It can, yes. Yeah. So nothing is foolproof because that's what they said to her as well. She understands that you can still come. Obviously, it's just reducing. Everything is about risk reduction. So it's something that way you can't just decide in one meeting. You have to think about it and be sure it's the best thing for you. Yeah.
A friend of mine actually she had the BRCA gene.
Oh, did she?
It's been like 10 years actually, a really, really close friend of mine. She had both of her breasts and she had her ovaries removed
as well, yeah.
Just because she wants to see her children grow up, because her mother died when she was in her 40s.
Oh, I see.
Actually, it's a horrendous thing to go through. But I know she's the bravest person I know.
Yes. It must be.
And she's the same age as me. She's only 49, 50.
Yeah, really. Wow.
Really young.
Yeah. So how did she get on with the surgery? Was it?
Yeah. I mean, she's been going through it since she had her 2 children. And then she decided that she works at Oxford actually, so she's really medically trained and everything.
Right.
So she just decided I'm going to have my 2 children. I've got the gene, and for the last 15 years she's been going through it. She's still here today. She's
exactly. And I think
birthday in 2 months' time. So that's a big milestone.
It is. Yes, and this is someone that may not have reached that milestone.
No, I mean she may not have, or she may.
She may have exactly.
She doesn't know, but she
yes.
has to. I mean, it was the most horrendous thing that she had to go through in her life.
Right.
And with her husband, relationship with her husband as well. You're right, completely. Kind of, I mean, luckily they're still together, but
it's very touch and go, isn't it? It is, yes.
My sister-in-law had 25 years ago. She had bilateral breast removed.
Oh, really? For the same reason, was it?
It was for the same reason, and it has relapsed after 25 years, and it's going into problems now.
That's the problem. You can come back.
You still come back. Yeah, because I was thinking about that actually.
That's why she has her ovaries removed as well. As I said, that actually, if it doesn't come, if it's not in her breast,
you come to the ovaries. Yeah.
So she had those removed as well.
But then, if they have breast cancer, and if it all gets done, it can come back in some other way, yeah? You can have some other cancer as well.
Well, exactly. So once you've had one cancer, we tend to take sort of like view that you could then have another type. So if you have a cancer patient and they come in complaining about a totally different part of the body, we always sort of quickly try and get them in, because we're like, oh, the patient already has cancer, who knows what's brewing. So you're right. I mean, these things happen. But I think with your friend, what she's done, she just bought herself time, isn't it, with her children, and that's all you can do. Exactly, borrow time. Exactly, and that's and the thing, obviously, I've had cousins who've lost their mother at a very young age, and so I think any time you can buy, to be with the children, Not that I'm saying people should go and have any surgery, but I appreciate the fact that the children will benefit from having their mother around for longer. And this is sort of things we're seeing now. But at least the good thing is we have a system that can sort of help people out, and it's not too expensive. And people can get seen, and obviously the take-home message is just check your breasts. I mean, I was going to ask you to provide me a model. any volunteers, because I could show you quickly how to check your breasts. But I did do, as I said, a TV series, and I put something on my Facebook page, so I'll leave my cards out so you just have a look. We had a young lady who was happy to. We didn't bear all, just wearing a very slim-fitting top, and we just sort of showed how to check. I think it's important you learn how to check properly. So that you know what you're looking for, really. But I think the take-home message, even if you don't know how to check it, as long as you know what is normal for you. What I want is, Dr. Gomo, I normally check myself, this is different, that looks different. I now have this, I didn't have it before. That's enough for me. That's enough for most of us. Okay?
How can you find out if you're a carrier of that gene?
You get sent for genetic testing, but there will normally have been so we won't just send anybody. So like that other lady I was talking about, who I was going through, I don't know her personally, but I was just going through the paperwork. Because I was on call, so I had to do that. She had a family member, I think, maybe her mother as well, yes, who had that. So obviously, when you, as I said before, I think was your question, if you get breast cancer patients, you always type the kind of cancer that they have, and then the family gets told. Because obviously it has implications. So you have female children, even grandparents and children, even aunties, siblings. Because some people are like, oh, my parents are fine, but my auntie has it, or do you see what I mean? Paternal or whatever. So the whole family gets to know, or should do, so that at least everyone is aware. And if you then realize my aunt or a close relative has that, then you can have go to the GP and be referred for genetic testing to see if you do have that gene. Does that make sense?
What's that gene called?
It's the BRCA2, so we call it BRCA. It's BRCA2 gene. Yeah. Okay, so I think I'm going to hand over to. I've already introduced her. Yeah, she can do her talk. Thank you.
Good evening again. Thank you all for inviting me today to talk about the NHS health check. It is free and it's for everyone, male and female. For ages between 40 and 74, you get a letter from your GP or healthcare professional, and the main purpose is to detect signs of stroke, kidney, heart disease, type 2 diabetes, or dementia. So everyone will be invited. You receive a letter from your GP, from the local authority, and the test to be carried out by a healthcare professional, sometimes the nurses in your practice. And it takes about 20 to 30 minutes. And during the test, you'll be asked lots of questions about family medical history, about your diet, how active you are, and generally about who you are in terms of your health. And the test entails health, weight assessment, height assessment, waist measurements, the blood pressure as well as carry out a blood test to check your cholesterol level. And the results will be explained to you, not necessarily during the test, but when the result comes out, you might get a follow-up appointment with your healthcare professional to discuss the results. And they'll give you like a personalized advice on how to manage risk. As perhaps you have high risk of diabetes. They'll talk to you about healthy eating, generally about actively eating, active health lifestyle. And if you have post 65, they'll mention the discussion will be around dementia, the signs to watch out for, and how to be safe and prevent any of the preventable diseases. Any question around that? I believe most of us are over 40.
How often are you supposed to have a health check? Every year?
So basically, once you are over 40 to 74, you get it, mostly every other year. If you've never had it, you need to contact your GP.
I have never had.
You have never. So you need to go to your GP practice and ask for that
So
appointment.
it should be every other year?
Yes.
Oh.
So if you are 40 and above, you get the appointment. You should get the appointment. You know that.
But don't you qualify for it if you're on no medication? If you're on medication, then you don't qualify for it.
Sorry?
It's only for patients who are on no medication.
Generally, even if you are on medication, you still be seen for the NHS health check if you are between 40 and 74.
I had it when I was 45.
You got
Only when I was 45 I got what I was saying, and about that was 45. That was 5 years ago. So I never got it.
so you should get it.
They use our doctor's surgery.
Yeah.
So
So
they
they
used
send
to
out
send
the
letters out, but they've stopped it now, saying that they don't need.
some patients get missed. I think if you've not received any letter, please contact your surgery. It is quite important. Yes. Some patients get missed.
More work.
Yes, more work. But it's usually done not by the GPs, by the practice nurses. Yeah.
Is this a recent thing or is it ongoing for
It's been around for a while now.
I went for my B12 injection last week,
Yes.
and the practice nurse told me that have you had this?
And you said
Can you
no.
make an appointment? So I made it.
Good.
Yeah.
I think the local government is
But
now
I wasn't-
employing.
I didn't know about it until she told me. I only went for my B12 injection, and she said, have you had it? And I said, no.
So it's been around for a while, and the local
But
authority
it's
is
not
now
advertised
employing.
properly, is it?
The local authority is now employing more health professionals to help facilitate this.
But it would help if we go for our appointments like this and we're made aware of it.
I think it depends on each GP surgery. It should be automatic once you fall within the age group of 40 to 74. But obviously, some people get missed, unfortunately. But if you've not received any of this letter, please contact your GP surgery and ask to make an appointment for the NHS health check. It is free. Okay?
Somebody should pay for your health.
So the second topic is about cervical cancer. And this is what is related to us women. It affects only women. Lucky us. And it is a cancer that affects the neck of the womb, which is the cervix. It is preventable, but it is one of the deadliest cancers around. Dr. Agoma has spoken about the breast cancer and now the cervical cancer. We have to take ownership of this, just like the breast cancer as well.
Now they give the injection HPV.
Yes, but I'll get to that in a moment. It is caused by the human papilloma virus, the HPV, and the symptoms include abnormal vaginal bleeding during or after sex, between your periods or after you've been through the menopause, just like Dr. Agumo mentioned earlier. If you have any of these symptoms, please speak to your GP, okay? Another symptoms could include pain and discomfort during sexual intercourse, not related to dryness, unusual or unpleasant vaginal discharge, and pain in the lower back or around the pelvis. Are we together? So the statistics of the incidence. Like I said, it is preventable, but it is deadly. And over time, due to research, there's been lots of improvement in the incidence of cervical cancer. In 2015, there were 3,126 new cases of CC in the United Kingdom. However, in 2016, it contributed to 854 deaths in UK. So some people are still dying from this. It now attributes to less than, so it's improved over time, 1% of death caused by cancer. The good news is, not that cancer is a good news, but the good news is that if anybody is diagnosed with cervical cancer, they have a peak age to live with it between 85 and 86 years old. The mortality rate has reduced over time compared to when in the 1970s up to now it has reduced, and about 63% of women survive cancer for over 10 years or more. We are in the United Kingdom. like Dr. Agoma said, we are enjoying the benefits of NHS due to research, enlightenment, the news we hear about different kind of diseases. But it should be noted that countries, underdeveloped countries or developing countries, are still having higher incidence of cancer or cervical cancer, and this leads to high rates of mortality due to insufficient research, infrastructures, awareness as well, or people seeing it as a myth and not taking charge of their health. Any questions so far?
Is there a certain age where you don't get cervical cancer? I don't know. Or can it be any time in your life?
Anytime. That's why we get that advice about getting our smear test done.
Even when you're like in your 70s or 80s?
Well, I'll get to that in a moment.
Okay.
Yeah. So the prevention, like I said earlier, it is 100%. It is 100% preventable. But please get your smear test done. When you regularly, you get letters for that, I hope.
Yes.
So we don't get So you mentioned about the vaccination of the HPV. It is given to young girls between the age and up to their age of 12 up to their 18th birthday. So they're given the HPV for prevention. Another method of prevention is to avoid smoking and practice safe sex. Okay.
And it's just the one vaccination, right? One dose.
What does HPV stand for?
Human papilloma virus.
So is that a new thing?
Well, I think it started a couple of years ago. But when you were that age, it wasn't given.
It wasn't something that we
Is it mandatory?
Exactly.
Well, like any other vaccination,
It's up to you.
it's up to you. But it is advisable.
I think in schools actually.
give
The school nurses will send a letter to parents to
opt
give
out
consent.
if you want to opt out. Otherwise, they will be given it.
They will not give it. If the parents
Oh yeah, it is the way. If you don't sign the
if you don't
consent
give
form, then they
consent,
won't
they
give
will
it.
give
Yeah.
it. But they'll send reminders.
Yeah.
So you have to opt
They will
in.
encourage you. But it's up to you to decide if you want your daughter to have it or not. But I will advise you.
Even the
Does that
school,
prevent it, or is that?
It does.
even the school nurses goes in the schools and give the
Yes.
talk to the parents and
Mm.
advise them to sign the form. Then even sometimes the parents don't.
Well, we still have the level of parents not giving consent for their daughters to have it. But it is
And
advisable.
what could be the reasons for not denying to have it?
But like any other vaccination, parents make their
Yeah,
own
side
research
effects.
and they believe their research is more authentic than that of the NHS, or they advise to take up any immunization. Even for babies or young children, etc., parents still have the right. It is advisable, but it's not mandatory.
There's side effects, and some people believe in the side effects
Yes.
more than the benefits. So.
Okay. So, a smear test, also known as a cervical test, is an early intervention, and it is designed to reduce the number of people or women who develop full-blown cervical cancer. All women registered with a GP are invited for the smear tests by post. You get the letter by post, and if you're aged between 65 to 49, every 3 years you get the letter. If you've not received the letter, please contact your GP surgery. And if you're aged between 50 to 64 years, every 5 years you get the letter. And over 64, if you have an abnormal test, if you had an abnormal reading, then you get invited, otherwise no.
So does the risk decrease as you get older?
Yes,
Is that what it
the
is?
time gets just
Right,
the
so it does
invite
actually
time.
decrease. It's
Yeah.
not like breast cancer where you
No,
can get it
no,
any time.
no.
It can actually decrease
Yeah.
as you get older.
But the risk is still there.
The risk is
Yeah.
still there.
The test actually takes about 5 minutes. The effect of cervical cancer is a lifetime. So make the right choice.
If you have a hysterectomy done, then you don't get the invitation, you don't get the letter.
Not
It
necessarily.
depends on the type of
Because
But if you-
hysterectomy.
I had
you-
my hysterectomy done,
Yes.
and I never get the letter since then.
I think you should discuss with you should still get a letter and discuss with your practice nurse about that, or the GP.
If the hysterectomy was a total hysterectomy,
where you had your cervix removed, what would happen is we would do perhaps what we call a vault smear. So rather than taking it from the cervix, so there's no cervix now, you have no womb, the same HPV can cause vaginal cancer, which is now we become more aware of that. So we can actually take the smear of the vault. However, if you choose not to have any and you're low risk, because as you said, it's 100% preventable, it's from sex. So you have the same sexual partner and he's only had you, so there's no way you can get it now. You see what I mean? So we probably will say, if you say you don't want any more, we'll add it to the exclusion codes. Then that's probably why you don't get any letters anymore. Or if you were to get any bleeding, as she said, then please come forward for an examination.
Any other questions?
So what happens when you had your smear and your result is abnormal? So
You'll
what's
be invited.
Okay, so what's the treatment then?
So for that testing, yeah, so the treatment will follow the results anymore. So they'll diagnose and you might go through whatever the diagnosis, the chemo, the radiotherapy, etc.
But before you get to that point of the chemo and what have you, like I had a patient today, my first one, she had an abnormal smear test. So when you get your smear test back, it's either is normal or is abnormal. So when you use abnormal, there are three main things. It could be what's called CIN1, which is mild changes, which could revert back. So they're like, changes that could go back to being normal. And so you'll be invited to come back again and do a test in 6 months. But if it's CIN2, which is what this lady had, which is moderate dyskaryosis, which is the medical name. So she had to go and have a colposcopy. So how she went to have a colposcopy, you have to have, it's an examination where you look at the neck of the womb with a microscope, which is 1,000 times magnified, so you can see it, and you can stain it for some cells to see if there's any changes, and that's what she's going through right now. And then the stage 3 is, almost practically next to cancer. So you get all the treatment, as she said, where you get referred, and then the plan of action is made, probably going to involve some sort of surgery, removing part of the cervix, seeing if it's spread to any other parts of the womb and things like that.
Recently, about a week or thereabout ago, a nurse actually, she had normal smear test results for, repeatedly done every 2 years for her. And up until towards the end of last year, she actually had cervical cancer. So the result was actually missed for 2 consecutive tests. I think she died a couple of weeks ago.
Yeah,
she was on the news. So it's just for us to take, So we just need to take charge, and sometimes when they ask questions.
What would be the symptoms then? If you had it, what would be the symptoms? Because obviously if you've had the test it's been missed, what would be the...
So I'll leave Dr. Ogoma to speak about that.
Yeah, so basically, if someone has cervical cancer, which what she had, because she looked she was quite unwell at the end, so she probably had the symptoms that you mentioned in the slide. So the commonest thing with cervical cancer is the postcoital bleed. So you have an intercourse and you get bleeding. That is cervical cancer in our heads until proven otherwise. So that's the first thing we go for, and so that's the main thing. But again, as you said, things like there's spotting in between periods, so you always had regular periods and then something's not quite right because you're different from usual. All these things with cancer is a case of different from usual. So this is how I am normally. I normally have one side regular than the other, and now it's different. So that's how you pick it up. So she probably had the bleeding, but she would have been falsely reassured that her smear test was coming back normal, and I think that's the problem with that case was that she feels like she was failed because she got abnormal test, or she had an abnormal smear, but it was reported as normal, which is why even though there's a bit of a pain to the doctor to see the same patient for the same problem, again, it's not a pain because if the patient keeps on presenting, there's something wrong and you need to think again, you need to look again, and I think that's the take-home message really for all of us, as a patient as well. They say that you're fine, but you're not fine, and you're not just trying to get attention and malingering, then do go and maybe see someone else, get a second pair of eyes.
I think she went private.
Yes, she got picked up.
Yeah.
Okay. But in her case, they missed it 6 times.
They missed it, unfortunately.
The symptoms you've mentioned are very close to endomyosis. So is endomyosis malign, or is it a type of cancer, or is it just a disease that?
No, so endometriosis is not a kind of cancer. What happens in endometriosis, we don't really know what causes it, but our theories are this. basically your womb has endometrium. That's the line of the womb, that's what it's called, and that's how you have your bleed. With endometriosis, you also have the same material in the inside of the womb is on different parts of your body. So you could have it on your bladder, on your bowel. And so what happens is that when you're having a bleed, every part of the endometrium in the other parts are responding to the hormonal changes, and they're all bleeding as well. So you're having, your heart said it all. You can imagine, so it's pain. So so it's similar symptoms. But with endometriosis, you don't tend to get the postcoital bleed. You get postcoital pain. You get pain during intercourse, not the bleeding. So the endometriosis, you have regular periods, but it's just heavier, very painful, and sex is painful. With cervical cancer, you may not even have painful sex, but it's bleeding. Because what happens with the cancer is that when you have intercourse, you're touching the cervix, the neck of the womb. That's how you get aroused, and that's how you get the sensation. So that is the area that has the cancer. So you're beating it up again. So it bleeds. And that's how we pick it up when you come and tell us that. Mm-hmm. It doesn't mean that's not the only reason, obviously, for having bleed during intercourse. So don't go worrying. But it's like the one we need to make sure you don't have. Especially if you have a history of, like a young patient had different partners, and their partner has, different partners. Because unfortunately for the woman, you get not the risk of your partner, you get the risk of all his partners before. So it's an accumulated risk. So that's why it's important to have, as she said, safe sex.
So if somebody has PCOS, then if they've been put on the pills, should they be invited to do tests regularly before the renewal pills are issued? Because I know somebody who had been on it for 10 years and never once were invited.
Been on what, the pill? For 10 years?
Yes.
Never got invited for what?
Never once were asked to come and do checkups or anything.
Right.
Until in the end, the problem was so big that she had a cyst growing the size of a 6-month pregnancy.
Oh dear.
And things were just going out of hand. Now, if you're not a medical person, you're not. All I could hear the person saying is, "Oh, I got a backache. I got a backache. I'm tired. I'm this. I'm that."
Right. So did she go in with all those symptoms, like the backache and the time? Did she go in with all that?
Yeah, they were saying maybe it's the stress at work because 50 hours work a week, and eventually they just there was just one big shock.
Right.
This is what's happened, and then she was shocked herself that I've been seeing regularly for my repeat prescriptions.
Exactly.
I've been this one, that one. So what's happened there? But then they couldn't do anything because they had to do full hysterectomy, and they barely could save.
Was it the cancer that she had?
At risk as well at the age of 34.
Did she have a cancer? Is that what she had?
No,
a cyst.
The cyst was just massive. And then at the first contact at the private hospital, they picked it up.
Right.
Saying, have you ever, nobody had told you. And this was picked up by a locum doctor who she went to see because she had swelling in her feet.
Right.
He said, let me check your tummy. He said, my mommy thinks her tummy is more this side than that side. He said, okay, let me have a look. And then he said, I can't even let you go out of my surgery.
Wow.
He just picked it up by 6 o'clock, 6:30, they started the ball rolling. And he said, no, until you fix me an appointment, I'm not going to let you leave the surgery. So all the private things were arranged and took her to the Clementine. And then the GP let go of her, saying, okay, fine, I know you're in good hands now. Because that cyst could have burst any time.
What you made a fair point.
Be, inviting them regularly.
Well, obviously, I'm not going to make a comment on that case.
No, but I'm saying generally, you had another case.
Exactly, and this is what I was saying, because today now I had the task of going through people's prescriptions, and people are requesting things, and I'm very fussy because I always bring them back, and people get upset with me because I'm cancelling their prescriptions. But I haven't seen you. I don't know what you. I don't know whether you still need this. So, but the thing is, to do that, I'm not trying to say I'm very good. I'm just saying, to do that, it takes a lot of time. And what GPs do not have is time. So what happens is that these things can get missed by anyone. So obviously no one sets out to harm the patient. But when you have a volume of things to do, I mean, you know how many things coming through, and you're under that time pressure. Things can get missed, things you should be checking. And then again, and I think this is why I really like doing these health talks. Patients, you have to start taking ownership of your own life. As she said, you have to get, if you're on a medication, go and see the GP at least once a year and say, do I really need this medicine? Do I need to be on this? Do I need to be on that? So I think it's important that you do that, to check that you should still be on certain things. And especially, with things like the pill, people just, I never give the pill easily. I always check. Because, do I know? There's a lady who had her mother had breast cancer, and she was given the pill, and she came out to see me for more, and I said to her, I'm sorry, I can't give you the pill. She said, oh, but the doctor gave it to me. I said, well, I'm sorry, but I just can't. I mean, women's health is my forte, so I'm going to be a bit fussier than other doctors because this is what I do. So I'm going to be more, you know, and I'm like, I said to her, if it was your great-grandmother, but this is your own mother, surely you must have some of her genes. Then she agreed with me that, okay, it's her mother, is too close for comfort. I said to her, I will be a very brave doctor to sign the script and let you out. I'm sorry, I can't. Because even if it's that 8% risk of the modifiable with the pill, I want to bring that down. I'm sure there are other methods you can use for contraception. It's not like, you know, there's nothing else that you could do. So I think it's a case of, you know, the time pressures. Unfortunately, with the best intent in the world, we do get things wrong, we do miss things. For the patients, wake up, take ownership.
And I think another thing is when to talk as well, isn't it? Like,
yes.
I knew about this.
Exactly. Which is why what you're doing is brilliant. Exactly. Yes. So people are getting more aware now. They're having more talks. Finding out stuff, you know, also the younger ones are going online. Dr. Google is the first port of call. We are secondary.
That's part of the problem for you, I'm sure.
I don't mind, because like, you know, you don't know everything, so they come with something when I'm like, okay, look at that as well. You never know. And if you're tired, it might just jog your brain and make you think, oh yeah, it could be that. So I don't mind Dr. Google as well. Or, you know, it's your choice. It's your choice.
So if you're taking, apart from everything that's been discussed tonight, if you're taking something out of here tonight, is take ownership of your health, spread the news